And again, for clinical trials, is this a friendly trial? Is this something that you can quit? Most trials, you should be able to quit the trial. You are not stuck in the trial. So if you start the trial and it's not right for you, you should be able to leave the trial. That's one of the things that you should watch for. How do you fix a herniated disc? Okay, so with a herniated disc, some people find that if they rest for a few days, they can get some relief from that herniated disc. Sometimes that's not enough, and you need to go in and do some non-steroidal injections. Sometimes NSAIDs or non-steroidal medications can help as well. What you want to do is get that swelling that's in that area lower. Good morning. So glad to have all of you here. And you also can try physical therapy on a herniated disc. And if none of those things are really happening, you could try a clinical trial to see what's coming down the pipeline and have first access to whatever that treatment option is. So like with the sciatic herniated disc is a form of sciatic pain if you have it in your lower spine. So if you have that pain in your lower spine and or have been a herniated disc or been diagnosed with sciatica, definitely give this trial a look and see as to whether or not this is the right thing for you. Now, with a herniated disc, a lot of times you are going to need to take rest in between things, just like with RSD, like I live with. If you can do some stretching, that's great. If not, again, that's something your doctor should be able to tell you if you should be stretching that disc or lower back stretches. Your physical therapist can also help you with specific stretching. And then if you really are finding that this is lasting long term, like for me, when I got the sciatic pain after surgery, I was able to relieve it with stretching. But if it's a crush injury or your disc is actually bulging and out of place, those are the types of things that you want to go and get additional help for. Join a trial, join something that is coming out. Physical therapy helped you, and you continue to core exercises. Yes, long term, whether you get a treatment or not, doing physical therapy that strengthens your core can be very beneficial in helping with that herniated disc. I think somebody else asked about the trial. So with the trial, again, you have to be 30 to 70 years old, and it's available for men and women. They want to do all types of patients between those ages. And the company that's doing that particular trial that I posted the link for is based out of Japan. So in Japan, this is a placebo trial. Another thing to look for as to if a trial is good or not. Some of the patients will receive an injection of a new medication that they're working on, and some of the patients will receive what we call in America a placebo. In Japanese, they don't have a word for placebo, or the closest word is the word sham. So they call a placebo sham, which I found quite interesting when I was looking and researching this study. And knowing that they use the word sham, if you see that on the website with the information, they want this trial to be able to be used by Japanese patients as well as American patients, and accepted by both governments as foreseeable future treatment coming down the line. So they have to use the words that get that covered. So you'll see sham instead of placebo, but it's the same word. It's just how it translates from Japanese into English. So definitely look for that. And yes, you can have an injury. You would be susceptible with RSD, with it being a autoimmune condition. It's in our blood. We have autoantigens in our blood, one or two autoantigens, types of autoantigens in our blood. And if you're susceptible and you have an injury such as a sciatic injury or it's really any trauma to the body, you are susceptible to developing the symptoms of chronic regional pain syndrome, reflex sympathetic dystrophy, and that type of thing. Condition, central pain syndrome. It has over 20 different names. But I am going to leave you with the link in the website and the link to the sciatic and herniated disc option, because I've talked about that the most here. But there is other on CureClick, the CureClick site you can go to and get more information on many different trials. And I have personally vetted the CureClick site and follow along and make sure that I'm posting, and the International Pain Foundation is posting about clinical trials that are important and usable. So we are going to end it there. I appreciate everybody tuning in, and I will be back again talking more on clinical trials and other options that are available in the coming weeks and months. So I appreciate everybody who tuned in, and please take care.